Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon, ladies and gentlemen. Good afternoon to all our followers here in this page. Again, we are back today with another interesting topic or interesting talk with IOM, International Organization for Migration. We will be talking about mental health in the Gambian community and some of the structures and supports that IOM can offer. So just give us some time. And I am sorry, the discussion will be in English because it is IOM and we will be using English. My guests are IOM staffs and they will be joining us very soon. We found it very interesting to bring IOM members to talk with them because there are a lot of issues, mental health issues, you know, that there are a lot of problems and issues regarding mental health issues. So just give us some seconds. My guests they will all join very soon. Yeah, they're coming.
Hi.
Hi. I'm fine. And yourself?
Good, thank you.
Perfect. Thank you for joining me today with your team.
Sure. I think we're just waiting for a couple of people.
Exactly.
The panelists are joining in a few minutes.
Exactly. Sorry, that was very soon. Yeah. Good. And how are you? How is Berlin? The weather in Berlin is good?
Very good, but the weather is bad. No. Unfortunately, no positive news on the weather, but overall, very good. Thank you. How about yourself?
I am doing good. Yeah, you know, work as usual. All is good. I'm happy. All is good. Caught by Corona 1 week ago, but then I am fit. It's like, yeah, without symptoms, and it's all okay. You know, Corona.
Perfect.
Thank God. And the viewers, if you are listening to us, please let us know so that we can start very soon. Please let us know. Just any of you can comment, says that you are hearing us loud and clear. Then my able guest will start the opening remarks. Okay, let me even share it to all other WhatsApp groups. Yes, very soon people will start joining.
I think we're only waiting for Yvonne.
Okay. When he is here, you can just let me know.
All right.
We can start. Hey Ben, how are you?
Hey, I'm good. How are you?
I am doing good too. Nice to see you once again.
Nice to see you too.
Okay.
Great. I think I see Yvonne, who just joined us.
Good. So I think are we good to go?
I think we're very good to go. Thank you, Yvonne, for joining. We had a bit of a technical issue, but that is no surprise.
And that's my fault. You guys are perfect. The technical issue is from my end.
Okay, great. Then perhaps I would kick off this meeting. So hello, everybody. My name is Vulela Nikosi, and on behalf of IOM Germany, I would like to welcome you to this Facebook Live session. This exchange today is dedicated to the topic of mental health in the Gambian community. And it's also quite a timely topic because today is World Health Day. But before we dive into the subject matter, I would like to extend my gratitude to 𝐷𝐻𝐻 Zonko, who has been a great advocate and supporter of the Gambian migrants in Germany, and who's lending his platform today, Support for Humanity, for this exchange, and who has also graciously agreed to moderate the event. So thanks so much for that. And I would also like to welcome our panelist, Yvonne Jatta from Caritas Stuttgart, who's been working as a social worker for Caritas since 2013, and has extensive experience in working with migrants and refugees. And I would also like to welcome our other panelist, �W𝐚𝐬𝐿 Binan, our mental health and psychosocial support officer, who's working at IOM the Gambia. And with these short welcoming words, I would like to hand over the floor to 𝐷𝐻𝐻 Zonko to take it away, please.
Thank you very much. Thank you for that wonderful remarks. And of course, you are always welcome. As far as these are important topics, important issues that Gambians need to know, or migrants need to know. Definitely, my doors are always open. Yes, I think we should not waste much time. We can first of all, I will give. You already introduced our panelists, so I don't think there will be any need to go for that for them to introduce themselves. But if anyone feels necessary, you can he or she can introduce him or herself. So yes, basically we today, like you said, we are going to specifically talk about mental health in the Gambian community. I as a Gambian activist, as somebody who deals with Gambians, in Germany, I definitely, and many Gambians will agree with me. Of course, all Gambians will agree with me. There are a lot of mental issues and concerns when it comes to Gambians in Germany. So we want to open doors for Gambians, for the community, to know and to understand that these are issues that sometimes are normal. They do happen. But when they happen, there are structures. But when they happen, there are structures. There are places where you can go and look for help, search for help. And IOM is one of those institutions, that are there, open to help and coordinate with you anytime you need them. So being the case, we are going with our, I will be asking few questions that probably you guys can talk about or help people, our viewers, to understand exactly what these things are. We will start with, when we talk about mental health issue, there is a wording, MHPSS support in Japan. What does that probably I and you understand, but our viewers, and Gambians, the community, did they understand this more? What is the exactly meaning of MHPSS? Can any one of you try to put us through? Thank you.
Thank you. I think you can just call out the panelists to answer directly. So perhaps we can ask Binan Evans to go ahead and answer the first question. If you can hear
Evans,
clearly.
Please come, yes. Evans, please come on board. Thank you for that.
Sorry, can you hear me now?
Yes, we are hearing you.
Okay, so when we say mental health and psychosocial support, what we're trying to infer is any form of local or outside support that an individual receives, which is aimed at protecting or promoting their individual or collective well-being. And so it also goes further to speak about the individual's ability. I'm trying not to cite it directly, but then it goes further to speak about the individual's ability to cope with daily stressors and being able to function more effectively in their communities or societies. So we're looking at it from a positive position rather than seeing it from a negative or a disease condition. And so more often, many people try to see mental health from an angle of negativity. So mental health, it's not something that is negative. It's just expressing a state where the individual can be able to cope with many stressors around them and be able to still remain more productively. So that's just the basic definition of mental health in, if I would say, and that is majorly the definition put before us by WHO. But then I tried not to go a bit scholarly. I tried to make it a bit clear so that we can have a basic understanding of that. Over. Thank you.
Thank you very much. Thank you for that wonderful, brilliant explanation. When we talk about Ben, probably let's talk about this. What do we mean? What do we mean by mental health challenge faced by Gambians in Germany? You know, what are some of the, like, what do you know, or what do we mean by this?
I think, Yaya, you can please feel free to go ahead and ask the panelists directly so they know that they're addressed. So okay. Perhaps Yvonne could take this question.
Evans, yes. Evans, let me, Evans, I think I still continue with you, you know, or let me try to reframe my question again. You know, let me ask you this other one. What support options exist for Gambian migrants in Germany when we talk about mental health issue?
You talk to Evans now or to me?
To Evans.
Ah.
For me, I wouldn't be able to say exactly what is available for migrants in Germany, but what is available for migrants or any other person in the Gambia is what I would like to talk on. And if you can permit me to say something about it, the mental health system in the Gambia is a kind of system that is a bit structured in a way. And when I say structured, I'm trying to imply that it has different layers. So it has the primary level, it has the secondary level, and then it has the tertiary level. So, and I'm speaking majorly in terms of what is available at the government facilities. And then also we have a few other private individuals providing some sort of counseling, psychotherapy, and different other things. But with a key focus on what the government is providing, in the Gambia, there is a mental health system wherein at the lowest levels where you have health centers and primary health cares and other things, you have different focal points providing mental health services, providing, let's say, psychosocial support services at those particular levels. So they would give counseling, they would refer, they would support patients in terms of recovery and treatment. And then at the secondary level, you have, that's where we talk about the district hospitals and different other hospitals. You have MHUS's focal points who are trained psychiatric nurses providing these services to their communities, and also migrants by extension. So returnees, migrant returnees by extension. So these services include medical care. It also includes counseling as well. Also includes referral. Also includes assessment of the needs of these different migrants, migrant returnees. And then at the tertiary level, where the Gambia has 7 health regions. Although politically the Gambia is divided into 5. The Gambia has 5 regions and 2 municipal areas. But then in terms of the health regions, the Gambia has 7 health regions. And in each of these health regions, there is present a psychiatric focal point to provide this type of services to migrants, to migrant returnees and their communities. So these services, as I had mentioned earlier, include counseling, referral, medication, medical care, and even other forms of family support and home visits. So at the same time as well, we also have regional social workers at the different Department of Social Welfare. Of course, in each of the region, there is an office. So these social workers combine, work closely with these MHS focal points to provide follow-up care, especially in supporting patients who need follow-up care after treatment, who need to be visited, home visits, community visits, and different other things. So these are majorly done by the social workers and others. Then at the topmost level, which is the tertiary level, you have the Edward Francis Small Teaching Hospital, EFSTH. And under the EFSTH, there is a psychiatric unit devoted for mental and psychological, for severe mental and psychological cases. So returnees with severe mental health conditions who have actually meet the criteria from these different levels of care. Perhaps they started from the primary level of care to the secondary level of care, and are being referred to the tertiary level of care, receive some sort of holistic kind of specialized care in that facility, wherein the majority of them are admitted and then placed under monitoring and medication, and then with a complete team attending to them. When I say complete team, I mean a team of psychiatric nurses, a team of registered nurses, a team of social workers, and then different other psychiatrists and others. So that's in terms of mental health for returnees. These are the kind of based on the system. This is how the system is. This is how the system works. However, at our office at IOM, we have different support system as well for returnees. Returnees at our office receive counseling and different forms of support in forms of community monitoring, where we visit them in their communities and their homes to engage with them and understand their needs, and even review treatment outcomes and see if there has been any much improvement. If there has been not, then we would try to also review and see and check through the drawbacks and what we need to do better. So these are the kind of things we provide at IOM. And then most recently with IOM Germany, I think last year or the year before, I think we've been having a project when we were able to develop a system where returnees from Germany can call their loved ones back home and speak to them and talk about their different many stressors, and also solicit different kind of support from their family members. So that has been a work in progress, and we've had colleagues a female to also mainstream gender into it. We had a female colleague and a male colleague who have been attending to them in that capacity. So I would say that is specifically and major lead. And then also in terms of arrival and reception, you know, some returnees receive some kind of support at the airport when they arrive in some of psychological first aid, wherein we try to ensure that the environment around them is a bit safe and okay for them to move forward and to continue to process and reprocess their return. So that's majorly aid in terms of what we offer for the mental and psychosocial support of returnees, migrants and returnees. Thank you. Over.
Thank you very much. Thank you. I think that's a very detailed explanation to what IOM is offering in the Gambia. Thank you very much for that detailed explanation. Again, we will. I will go to Yvonne. Yvonne, what about Germany? When we talk about mental health challenges faced by Gambians in Germany, what are we talking about?
So I can give you 3 of the main diagnoses we have in the camps. It's like post-traumatic stress disorder, paranoid schizophrenia, and depression. These are the 3 most diagnoses we see on papers by doctors. And these diagnoses are very important also to for the Sozialamt, we call, so the people who are responsible to give the rooms to people, because some of the people, they cannot cope with roommates. For example, they cannot cope with lots of stress in the camp. So they need single rooms. So it's important you go to doctor and have this diagnosis on paper. So Sozialamt will tell you, yeah, okay, sure, we give you a single room. This is a little, they can calm down. So some of these named mental health problems show physical pain, mostly. So physical pain makes them go to a doctor, and the doctor gives them painkillers, which will not solve their problem in the end. So they get frustrated. They say, oh, what's going on here? I feel pain, I feel pain. The doctors cannot help me. So they go to, I don't know how many doctors all over Stuttgart to find the solution, to find the happy pill, which does not exist. So it's, for us as social workers, it's also important to educate those people, to tell them, well, to explain to them, this is how your brain works. This is how your brain deals with stress. So this is giving you pain. You feel the pain, but the pain is not a physical pain. It's coming from somewhere else. So like what support options exist in Germany? Like I can speak for Caritas, of course. We have, Caritas initiated a project in 2014, which is called 𝐵𝐚𝐷. This is the Persian word for hope. In that project, the project is based on the gained awareness that 40% of all refugees coming to Europe, they are traumatized by experiences in their home country, by experiences they have on their way to Europe, or even by things they see here, or they feel here, or they experience in Germany. So the social workers in that project, 𝐵𝐚𝐷, they try to support with finding and creating a daily structure and offer individual support by confidential conversations with specially trained interpreters. They give you relaxation and exercise methods or creative activities. And every refugee in Stuttgart has access to that project. And if you are struggling with mental health problems, please go to your doctor first, of course, and also go to your social worker, because all the social workers know about that project. They can give you the phone number, or they can even make an appointment for you. I think that is really important to know. So don't be quiet, don't keep quiet, just talk about it and seek for help.
So basically, just a follow-up question regarding this project that you're talking about in Stuttgart. Is it only in Stuttgart or in entire Baden-Württemberg?
No, it's only in Stuttgart.
Okay, so this is only in Stuttgart. And how often are you, hence it is ongoing project, You know, are you in any way receiving complaints, or are you receiving cases from the Gambian side?
No.
Exactly.
No.
So
I have many young Gambians, or I saw many young Gambians, but I don't think they are aware of mental health issues a lot.
Exactly. This is the importance of this program today. We are here to give chance to my fellow Gambians, brothers and sisters, anybody who will be who is watching or who will be watching this program. Please kindly, you can refer yourself, or you can contact, like she said, you know, ask your social workers. There are a lot of cases, Gambia mental health cases in our homes. We are all living in it. You and I knows about it. You watching this program or will be watching this program. You know, don't sit with it till it is late. Sometime, it is an advice to my fellow Gambians. Sometime, somebody you are living with, a fellow Gambian you are living with, going through a mental issue, he or him herself might not be able to be at a better position to report herself, to help herself. But when you are living with them, you understand. When you detect or you seeing issues like they are traumatized, they are having mental issues, kindly help them to contact Caritas, IOM, or your social workers to find for help. This will be very, very helpful. And thank you for this explanation. Again, where is your office located? In Stuttgart?
Maybe you know Stadtbibliothek, the biggest camp in Stuttgart?
Yes.
Tonshofer Straße, exactly.
So that is where your office is located. So just these are follow-up questions to make it clear for my fellow brothers and sisters. Should they make appointment? Because this is also difficult in some cases. Some will say, I went there and I could not enter or something. So they make appointments. Should they call, or should they send email, or they can just go to your office?
It's very easy. You go to your social worker. You talk about what is your issue. You talk about you have something. You have stress. You feel stress. They give you an appointment straight.
Okay. Another question. That is, if I am struggling, just to help people to understand, if I am struggling with mental health issues, who should be my first contact person? Should I call IOM? Should I call you? Who?
Well, of course, your doctor first. Call your doctor, go to your doctor. And if you see your doctor and after you come to your social worker, if the doctor does not find any physical problem and he gives you maybe the hint, there could be something else behind that, then you should go and search for help for a mental health issue problem solver.
Okay, thank you. Then I will now transfer to IOM colleagues who are here. When we talk about these issues, I think, Max, are you available? When we talk about these mental health issues, this talk is purposely for Gambians or Gambian migrants. And when we said Gambian migrants, it also has a connection with their status, living in Germany, being in asylum or granted asylum or whatsoever. So what I want to understand is, or what I want you guys to help explain to us is, somebody with an individual with resident status, Duldung, or etc., can this affect their access to these mental services? Max? Max,
I think this is a question for Yvonne to answer.
Okay, no problem. Then we get back to Yvonne again. Thank you, Max.
Oh, it's me again. Well, I think yes, in some, like, not the project I mentioned, this is everybody has access no matter what your status is. But of course, when you have Duldung, you have restricted access to health services. That means these papers they get for the doctor, they don't have this insurance card, they have these papers, the blue ones and the pink ones. and they are only for acute treatment of pain. So there's no, if you have any problem with addiction, for example, because of your mental health issues, there's no therapy for it. You will not, the therapy will not be paid. This is not in the law for you. And of course, since you have limited access to job market, that would increase your problems, right? Because this is what you're here for. You know, you're not here to sit and wait and sleep. You're here to work, to earn money, to support your family in your home country. So of course, this is not good for you. So you have this limited access, and also you have reduced benefits. You have 169 euro every month, which is not enough to live, but maybe too much to die. But this is really, it's frustrating. It's like a vicious circle. Your microphone is off.
Thank you. Evans in the Gambia. Evans, I will like to for you to help us understand this. Of course, probably there is somebody here in Germany who is suffering from mental issues, and he or she considered to go back home voluntarily through the IOM voluntary returning package. Regarding their mental status, who should they contact first? Or how can they be helped? Should they contact IOM Berlin office? Are they allowed to call you in the Gambia for advice? How does this work?
Thank you, Mr. Sonko, for this brilliant question. For returnees here in the Gambia, right, we have a very free and open door policy here. Mm-hmm. It's more like an arrangement that works best for us. So whenever we have returnees, in most instances, the sending mission would mostly flag to us that, yes, these are persons in some sort of psychological distress. And so once we have been informed of that, we know that, yes, we need to pay extra attention to their needs and even pay extra attention to their concerns. And so in the case that we are aware of that, we try to make the necessary provision here from our side in terms of how we receive them and in terms of how we support them after receiving them. So once they are received at the airport, we try to make the environment very okay and palatable for them in a way that we try to, but prior to that, we also try to inform their family members that so person is available and he or she may need some sort of family support. And trying to generate family support for the returnee who has some sort of psychological distress is not saying that we are handing off ourselves away from that, but then just to make sure that the environment back home is a little bit warm so that the individual can find an entry point to continue to transition to recovery. So from then on, the returnee continues to receive support from our side. If there is any reintegration support, that support is fast-tracked. If there is any more form of, we also try to send them immediately to the hospital for another form of assessment because there's a need for confirmatory assessment. And so here, the clinicians here make another confirmatory assessment to understand the situation and to also know better how to support them based on their peculiar needs. So once this is achieved, then we focus more on how to support them economically. So when I mean economically, I mean in terms of supporting them in kind to have some sort of business or some sort of activity in their lives that will enable them to move forward because, you know, of course, we are talking of mental health and well-being, and so the different ingredients which include economic and social on top of the psychosocial ingredients will have to be well packed in order to ensure that the best kind of support is provided. So based on that, we continue to design like individual treatment plan, like not treatment plan per se, but an individual follow-up plan, wherein we follow up these returnees to like more of a check-in to know if there has been any progress since their return, and if there has been any relapse, because also we are clinicians and we also have to ensure that our patients are in the best kind of position or situation upon return and even long after return. So we try to make this follow-up to understand, and where we feel there are gaps, especially in terms of family support, we try to initiate a platform through which the family can also take responsibility of the care of those individuals as well. And I can tell you that the majority of those who return to us with those kind of situations, maybe some sort of psychological distress, have actually expressed some sort of relief some moments after they have returned. And that has been key to the fact that they have been receiving a reasonable degree of family support and even community support at the same time. Not to also say that there hasn't been others that have not shown any much, that have only shown marginal improvements. So basically, in terms of supporting returnees, these are the things that we do to, among others, these are the things that we do to support their sustainable reintegration after return from any part of the world, be it Germany or Libya or any part. Over.
Thank you. Before I leave you again, this is also another follow-up question. Somebody just sent it to me in my WhatsApp. And he says that what he is trying to explain here is like we to many Gambians, or how they believe is Germany might have better. This is his assumption. Germany might have better support for mental health issues. So if they're having a guy in Germany who is mentally ill and the family really want him to come back, but the other side of them, or the part of the family, is also saying, no, Gambia, it's like, how are we going to control him? How are we going to help? Do you have any ways and means that if there is a family in need of such guidance and counseling, is your office open for them, for the family to kind of guide and counsel them regarding what is there for them at your level?
Okay, thank you very much, Mr. Sonko. Perhaps I didn't make that, I didn't explain that a bit more detail. In terms of whenever a returnee signals the need for him to return or her to return, like I said, our first point of contact is to get in touch with the next of kin, which is the family. And the next of kin, this family can be the brother, can be the mother, or anyone with legal right to actually stand in that capacity. So where we have access to these different persons, he or she will share the number with us in the first instance. And so we would try to contact them. Yes, we've had many of such experiences where some family members told their returnees that, told their children that the situation in Germany or the situation elsewhere is much better than what is obtainable in the Gambia and whatever. But then, you know, we are dealing with different systems, and perhaps the family is not even informed about what is available in the Gambia and what is also vis-a-vis what is available in Germany. So it is our role to psycho-educate the family so that the family can understand that yes, there are these opportunities for returnees in the Gambia. And so we do that a lot we take sessions. Our colleagues visit them at home to break the news to them, to understand. In fact, we also try to understand the family dynamics, especially when we have minors or others coming, returning. Like, we have a way in our social workers will visit the family to make like a family assessment and understand the dynamics, what is at play in the family, and also educate the family on what is also available nationally, like in the system. So, of course, we may not say what is really going on in Germany, but we can talk about what is going on here in the Gambia. So we try to educate these families. We try to invite some of them to our office to explain to them in detail some of these things that are actually available in terms of treatment and even the management of these individuals. But what we try to also encourage them to do and understand is that management of mental health issues involves the family and care practitioners. So what we mean by the family here is that the family has a role to play, and the family has to create that enabling ground for the individual to be able to recover from whatever situation. So we try to psycho-educate them on these different things, and then make sure that the message is well taken before any form of decision is made. At times, we try to delay this. We try to delay the situation because we're not sure about the position of the family until we get the right signal from the family, because that on its own has a positive impact on the healing and recovery of the returnee when he returns. So yes, there are such kind of misconceptions or misunderstandings, but then from our side, it is our role to psycho-educate them on the different many opportunities available, and that has been what we have been doing over the years. So over to you.
Yeah, you're muted. You're muted, yeah.
Thank you. Before I leave you again, there are people sending me questions privately, and somebody asked that, he says, we all know that sometimes Gambians with mental health issues in Germany, sometimes it's very difficult for them to take decisions of their own to come home. But he says, but if the family is willing, and he says, if the close family, moms and dad, they are willing to welcome their son back to Gambia with that mental health issue. But remember, this person who is suffering from the mental health issue cannot take this decision by his own because he's mentally ill already. Probably he cannot decide for himself. With the decision from the family, the close family, can IOM still help in the Gambia? Can you still help? Can you still go ahead with the decisions of the family? Because they understand, or we understand, that sometimes it's important. The first important thing is for the person himself to say that I want to go home voluntarily with that. But somebody who is mentally ill already, sometimes it's very difficult for them to say yes or decide. So how? And the family is badly in need for this person to come, but he cannot decide for himself. So how can IOM help in this situation? Thank you.
So thank you so very much, Mr. Sonko, for this question. Competency to make a decision is part of clinical practice, and it's part of those legal issues that we have to face as practitioners. And as practitioners, we need to also juggle in between the best interests of the patient and then what is legally in place. And of course, I can always tell you that it's always right for us to take decisions that are legally in tune. So in most instances, what we do, you know, we are a receiving mission. We are not a sending mission. So we are receiving at our end. So receiving implies that almost every legal whatever has already been taken care of from the other end. From the other end. And so what we do from our side to facilitate those kind of decisions or those kind of arrangements, like I mentioned earlier, we try to put the family in the loop. We tell the family almost everything that we know. At times, we request for the medical report. And this medical report, you know, it's always on a need-to-know basis. Not everyone should have access to that medical report. But when we're able to understand what is medically in place, then we can be able to advise the family based on the information we receive from the sending mission. So we will tell the family that so-so person is so distressed, so. Of course, we understand the type of, for instance, if someone has PTSD, or if someone has psychosis, or if someone has mood disorders like bipolar or depression, it is our role to explain to the family what this type of sickness is and what this type of, and the type of support that the individual will need in terms of managing this type of illness. So it is our role to educate them properly on that. And so based on the education we provide, I think to a large extent, we'll support the family. We could, in fact, there are many instances where we linked the family up with the returnee, like to speak directly to one another, so that they too can also have an understanding, a first-hand understanding of the issues that the individual is facing, and also talk directly to the individual, and also take ownership of the problem even before the individual arrives. So we have facilitated many of such. We have facilitated many of such in terms of voluntary returns. And so that has also led to the kind of decisions the migrants have made. But for us, from our end, if someone is returning as such, of course, we will have to get the consent forms and other things from the other end, which I guess was facilitated through maybe communicating with next of kin or someone around who has actually been in the legal capacity to support with that. So majorly, yes, from our side, we try to facilitate that kind of environment that will enable the right decision to be taken. Of course, we are also mindful of the competency of the individual to take decisions on their own. So over.
Thank you. Before I again, probably this, just last one more question, then I will turn over to our Caritas panelists. So again, we're talking about mental health issue. You know, this is a big concern, and people with mental health issues, it's like it varies. Some are cool type, some are, I'm sorry to use this word, some might be aggressive, you know, due to their sickness or their due to their sickness. Some family members are concerned about this because, as far as I know, and as far as Gambians are concerned, there are some history backgrounds. Like 2 years ago, there was a returnee, and this has nothing to do with IOM, you know. This was forceful returnee, let me put it that way. But then he went home with mental health issue. And after 1 year of living with the family, he is completely mentally ill and aggressive. He killed his father in Brikama. This happened. This is a concern because many issues like this always comes to me. Families, and you know, like my son is sick, our family member is sick in Germany, but we are worried. Bringing him here, will that not, you know, will that not increase his mental health issue, will that not make him aggressive? Just to make my question now, what can IOM do with a returnee who is mentally ill and aggressive? Because it is a big concern for the family, for the community, security purpose, and many things involved. But for a returnee who is mentally ill and aggressive, I'm sorry for using this word, but it do happen. What can IOM do, your office do, to help in terms of, to help the family in this level, at this level? Thank you.
Thank you very much, Mr. Sonko. I'm back again. You know, I'm just a bit. I'm trying to use the right words here. You know, at times, what we do for people with mental health, and if you notice, I've been using psychological distress more than mental illness itself.
Okay.
It's not that I do not know of the existence of the term mental illness. I am trying to avoid the use of that term because it's already stigma. It's stigmatizing on its own.
True.
Psychological distress puts us at the level where we try to understand and reason that anyone could come down with that. And so when we talk about mental illness, you know, returnees have gone through a lot, and we need to appreciate them, you know. We need to appreciate them because if you look at the journeys, these guys, the kind of risks and many different things that these guys went through to be able to get to Europe or any part of the world, it's at times so traumatic and heavy. And so if you're not someone who is so used to hearing stories of this kind, you might just find yourself collapsing so easily. This kind of experiences, some of them heal over time, some of them continue to stay a bit dormant, while some of them are just somewhere around the subconscious level. So whenever something happens, let's say they are faced with a kind of stress or stressor, it can trigger that. And when it triggers that, you find people reacting differently. And so this reaction, this different stress reaction can be interpreted differently by many people. And that can also lead us to what many people refer to as aggression. And this aggression that many people talk of, mostly I can say that majority of the time is triggered by either the immediate surroundings or is triggered by some sort of issues that are quite evolving. And so we find many migrants we find many returnees back here in the Gambia with different mental health status. And these different mental health status have been supported, like I mentioned earlier. We work closely with MOH, with the Ministry of Health through the National Mental Health Program. And because of the kind of synergy that we've enjoyed with them over the years, our returnees have been given very good attention in terms of their needs. And so when a family calls us to say, hey, we have witnessed returnees so came back a month ago, and since then he has been aggressive. You know, it's very important to judge when you hear from both sides. And in this case, we're just hearing from the family, and we try to take their words very well and then try to see if we can engage them further. So what we do in this sense is to try to understand what are the family dynamics. What was the nature of the aggression? When did the aggression, the start date of the aggression? How did the aggression, how did it start? We try to establish these different things from our side. And when in establishing these different things, we try to understand, we get to understand at some point that majority of these aggression that is being referenced is related to is related to family issues or surrounding issues. There are instances where families use abusive words on their returnees, on their kids. Some of them will say, you left for the back way, you came back with nothing. Sorry, I'm using the term back way because it's a popular word.
It's the fact. Yeah.
So you left for the back way without anything. You came back with nothing. We've wasted our monies. We sold our pieces of land. We sold everything. Even we even went around to get loan from cooperatives in our communities just to sponsor you. And you came back as useless as this. Yeah. Look at the only thing you are back with, illness or what? So families use this kind of word, and these words are repetitive. They do not use it once. Some families, they do not use it once, they use it repetitively. So these are the kind of situations, and at times permit me to also use this local term. They will say "kid fadov" or something. They would always say all these kind of words, and these kind of words are words that actually trigger aggression. And so at times we find these returnees. I would say, based on my experience in mental health for the many years so far, I would say that aggression is mostly triggered. Aggression is mostly triggered, except where you have people with some sort of personalities, maybe some personalities that are a bit quite aggressive in a way, and then coming down with mental illness may actually cohabit that kind of behavior. But then what we're saying is that it's mostly triggered. And so if we need to work on these things, first, when we understand that, we try to understand the family dynamics. Secondly, in trying to understand the family dynamics, we try to also link up, like I said, we try to also link up with these different mental focal points in these different regions to intervene in this kind of situation. And then where the situation, from their assessments, if these situations are a bit proper and okay, and they feel that based on their judgments, not IAM's judgment, and they feel that these returnees will benefit from some sort of structured care or follow-up care, they would make those recommendations to those different health facilities at those different levels I mentioned earlier. So this is based on assessments, reassessments, and then forms of interventions that will actually support in that. But then I would say that the majority of the time, this aggression is largely triggered by words we use and how we view them, and then stigma and discrimination. When you find a returnee walking on the road, you find people pointing hands on them in the community and other things, especially when the returnee returns with some sort of psychological distress. People begin to point hands on him. This one, he came back mentally disturbed or whatever. Like, we create, all these things are our own creation. And so if these things are our creation, then we need to also collectively work on these things to see how we solve it. And that is why I mentioned to you that we work closely with the National Mental Health Program Office, and then the social workers, and then the family themselves. Like I said, we have community visits and different other activities that we do to ensure that the returnees also are reintegrated. And we also had some other different programs like community outreaches. We had other activities like the formation of migrant peer support groups, where we have this kind of returnees where we actually created a platform for this kind of returnees to continue to discuss their different challenges and share with one another and seek for improved medium to support one another. So we have many strategies to addressing that. So that's majorly what I would say from my side. I have a lot to say, but then for now, I think this is okay. Over to you.
Thank you very much. Thank you for that one brilliant explanation. Thank you. And it's always detailed. Thank you very much. Evans, I am back to you. Evans, when we said that, are you here, Jata? Evans Jata?
Yep, I'm here.
Very good. So when we are talking about Gambian migrants, and most of the time, we, the Gambian migrants, we go through a process that is irregular migration, commonly called in Gambia back way. I am one of them who experienced this journey. I know how traumatized it is. I know how disturbing it is. I know how really difficult, any word you can use, you know. So going through all these things, some for years, some many months, you kind of succeed to get into Italy through the Mediterranean Sea. Usually you stay years again, or many months in Italy without no medical attention, without no psychological support or attention from anybody, usually. For years, remember going through all these difficulties, encounter a lot of things, being traumatized, being kept in prisons, in cells, kidnapped, so many things. Physically attacked, with all these things in your head. You came to Europe, Italy, no attention. Probably you proceed to Germany. In Germany, you are faced with the tough bureaucratic system, the tough bureaucratic challenge. You know, usually when you look at my brothers and sisters who are suffering from this challenge, usually you understand, you know, if you know the way, if you go through it, like somebody who experienced it myself, I definitely can picture where the problems lies. What is your office doing, or what is your project doing to help this community, these Gambians with these challenges, to get psychological support, therapies, etc., etc.? What is your office doing, or what can your office do? Let me put it this way. Remember, they went through a lot, so they really need this, and it's very difficult to have a therapy. I personally experienced it here. When I came for 2 good years, I was looking for it. There is only one option I got, and I'm very active. I can say that I was so active on searching for it. You know, I just got one, I think, refugees for it, something like this in Stuttgart. Okay, but then that appointment is like every 8 to 9 months. And you know what you are going through, the difficulties. You get even more frustrated with the latest, with the bureaucratic system. With, you know, there are a lot of things in your head. What is your office doing, or what can your office do in order to help in this situation?
Well, first of all, and I think this is the most important, listen. This is something they don't experience a lot. People don't listen to them. They don't listen what they have to say. Give them a safe place where they can show all their aggression, all their anger. And yeah, give them time. Show them you are somebody. You are somebody that is worth to be heard. And not you are just you are refugee number 172 coming to my office today. And I think this is something important you can give to people.
So is there, do you know any, or is your office in contact with like offices that support or, you know, therapies and, you know, like if a migrant needs a therapist, you know, and was searching it for so long, but could not find one. Is your office available to help them to get connect with this therapist, you know, therapeutic?
Sure, we are in contact with Refugio. We are in contact with PBV in Stuttgart. They are all doing therapy for refugees with interpreters, which usually the normal therapists don't do. They don't have interpreters. So then there's the German language. Most of them don't speak German properly to have therapy or to talk in a therapy. So you need interpreters. This is 2 offices in Stuttgart that do that, Refugio and PBV. But of course, they have long waiting lists.
Yeah.
But for that time, this project, the colleagues of 𝐵𝐚𝐬D are there. They give you the support in that time. They give you what you need. And even if it's only to give you, to connect you with a football club, for example, to do some sports, this is helpful sometimes. Maybe to help you with a small job to do, with something to do. This is what these colleagues can do for you in the time before you have your therapy.
Wonderful, wonderful. Yeah, this is. I think this is. Yeah, that's also a very good explanation. You know, the waiting list is always the problem. You know, usually because I, personally, Refugio, you know, I experienced that. You know, I end up got a help through, you know, a German through my networking. You know, but then when I went to Refugio in 2 years ago, you know, around 2019. It's like I should wait for 7 months, you know, and which at the time, you know, when you think about your situation, you said, no, I cannot wait for it, you know, and it even make you more frustrated, kind of, you know, definitely. So, yes, again, still with you, you know, your association or your project in Stuttgart. How are you helping Gambian community to know about this? You know, are you having any flyers, any programs? Are you attending any community program, Gambian programs, you know, where probably selling this project idea, just connect, networking. How are you networking with the Gambian community?
Well, we are trying, but for now I'm the only one doing that because I have special connection to a Gambian community. I'm married to a Gambian, so I'm more in contact with them. But for my colleagues, it's difficult because we don't have interpreters for a Mandinka or Wolof or whatever. So if you know somebody who speaks proper German and Mandinka or Wolof, connect him to me or her. We need that.
Thank you very much. Thank you. I will go now to I will go with Evans in Gambia. Evans, thank you for your deep explanations. Yet still I just want to make some follow-ups or some discussions regarding issues in Gambia. Like Evans, are you here?
Yes, I'm here.
Okay, good. Regarding the same issue, still in Gambia, there where is your office located? Are you in every region? You know, because some people will say that I am in, like you are in Gambia now, you know Gambia. I'm in Basel. I cannot get connected to Evans. Or my family, we have this situation and we cannot reach Evans. How are you getting connect with the Gambian community? Not only in the combos, you are in Gambia, you know what I mean when I said combos, you know, so how are you getting connect? How can people reach you without even coming to Serekunda or without coming to the capital city? Those in North Bank, in LRR, in URR, in CRR, how can they reach you?
Okay. Thank you so very much, Yaya, for that. You know, our main office is located at number 46 Karaba Avenue Pipeline, which is just in the city, in KMC, one of the municipal areas. But then, you know, because it's in KMC, it's a bit central to for those who are coming from West Coast, and then those who are also coming from North Bank region. So that is a bit central for those. But for those who are somewhere around CRR, that's we are talking of Bansang, and then downward to URR, that's Basse. So we have a sub-office in Basse, and our sub-office in Basse covers that particular area entirely. So, of course, you know, the Gambia is not so very big in terms of its landmass and space. And so anyone living within Bansang and Kuntao and all the Basse and all the other, and the villages around Basse can access services in Basse. Anyone living somewhere around Bara, Farafeni, West Coast region, and different other parts of KMC can access, and LRR, that's Soma, can also access services at our office. So how to reach us? Of course, it's very important for them to know how. It's either they come to the office, we're there 24/7, or, sorry, we are there on working hours, let's say from 8 to 5 mostly, and then they could be attended to, or they could try to, you know, for instance, like most returnees, upon return, we try to issue some IEC material, some leaflets, some different other things. So on that leaflets or IEC materials, we have our numbers boldly written on that. And so they can access us through that, through those information. And then as well, we also have different radio programs at different hours, at different times, to sensitize the public on different things that have to do with migration, including health and mental health. And so through that, we also give, my colleague Mohammed is mostly on the radio during those times. So he speaks in the local language, whether Mandinka or Wolof, anyone. He tries to put it across to them so they can understand. And through that, they can also get contacts of IOM and what we do and how to reach us. So, and also on our social media handle, IOM Gambia, there is a Twitter handle, there is a Facebook handle, there is an Instagram handle. So on those different handles, you can find information on how to reach us and when to reach us. So we have different platforms, and then also we have different community engagements, some sort of community-led awareness raising activities, where we are also able to tell the community about our presence and what we offer and how we can be reached. So we have different platforms through which returnees can reach us. And then also for those who are in Germany and seeking to return, they can also go online and get those information, whether on Facebook or on Twitter or on Instagram. If they want to speak personally to someone, they could just drop a message from through that handle, and someone would direct their messages to the right individual, and so they would be they would receive a response. So we can do it that way, and that has been we have been doing it as such. And so if anyone wants to reach us, I think through these different platforms, they can reach us. Thank you.
Before I leave you again, another question before I leave you again. That is still the same thing, the same situation. We are talking about returnees. We are talking about people who migrated for one reason or other. Okay, So with the expectation that they should come back with something, the Gambian community. So if these people came back with mental health is challenge, like you said, okay, let's say IOM supported them, okay, to get their health back, to be able to be properly reintegrated in their society, in the community. When they are okay, when they are good to mingle with the society, community. Again, what comes is how, remember they left for something. Now they are back. You help them. Do you go further to give them support, to properly reintegrate them, to have jobs, to have other educational supports or whatsoever? Like, I mean, after when they feel good.
Thank you, Yaya. And maybe my other colleagues from IAM would agree with me as well, that when we talk about reintegration, we don't talk about that to leave it hanging. We talk about a holistic process or a holistic approach to something that that in the end can lead to longer term relief and outcome and recovery as well. So reintegration on its own has the economic, has the social, and has the psychological and the psychosocial dimension. Our focus from my area, from my line, my focus is on the psychosocial element. However, for a returnee to benefit from the different other elements, he or she must be in the right senses, or he or she must be competent enough to be able to handle those other elements that will be provided to them. So in this case, when a returnee returns and he is in a state where he cannot be assisted, we can't assist them at that point. We try to, when I mean assistance, I'm meaning economic support. I don't mean assistance. So we can be on the same page. So most of these returnees, those who return voluntarily, have this access to this kind of in-kind support, in-kind economic support to enable them. Because of course, we are also talking of about the drivers migration. And the drivers of migration, part of it include poverty and different lack of access to economic resources and different other things. So this same individual now would have to regain their mental sanity. Not to say their mental sanity, but they will have to be stable. Once they are stable, then we start to plot. Already we have started having preliminary conversations with the family about what is due them. But then we try to follow up. We try to follow up on the kind of treatment they are receiving with MOH. And so in the long run, if we are able to see some level of improvements and we are able to see some level of stability, in the first instance, the economic support is for him or her. And so whenever they are able to gain this stability, we try to engage them in discussions on what is economically viable for them in terms of what they would want to do based on their skills, based on the community they are coming from, because some businesses do not flourish in some other communities, but they flourish in different other communities, based on their communities and based on the different assessments. And I can assure you that this is entirely client-centered. So it's based on the needs, based on their needs and what they would want to do and their skills. In some instances, some of them receive even extra support in terms of giving them some sort of education or whatever, but this is on a case-by-case basis. But however, they are also enrolled into training. For instance, if you say you want to do carpentry, what skills do you have to do carpentry? So we enroll them into that area so they can be trained by someone to be able to acquire that kind of skill, so that when they have that skill, they would be able to manage their business more appropriately. So in terms of building the skills of returnees, we have different partnerships. My colleagues in a different other area are handling that. where they have different partnerships with different kind of skill acquisition centers to provide different skills to returnees, so that these returnees can be able to handle this economic support and then be able to also handle their social fabric, which is a social support in terms of education and different other things, and then also their psychosocial support. So holistically, we look at their needs and how to support them. Thank you.
Thank you very, very much. Thank you very much. I will now go back to our German colleagues, Caritas, Mrs. Evans-Jata. Please, what can you tell us? Because within Gambians, confidentiality is something you might know about it. Hence, you have that special connection with the Gambians. The practitioners, the medical practitioners or health practitioners here in Germany regarding this mental health issue or psychological support, secret is very, very important. Gambians sometimes, when they are in these issues, they don't want people to know about their issue, their sickness, the issues that they are going through with. Do you think that the German side of it, I mean the health practitioners, do you think they are confidential? If you talk to them, they will not expose you at anyhow. They have no connection with Landrazam, with all these government institutions, Landrazam, big job center, whatsoever. Because sometimes, there are a lot of issues, ongoing issues, that you will not like to expose those things to Landrazam or to job center or whatsoever. Do you think they hold secrets?
Mental health practitioners, social workers, we are all bound to confidentiality. All of us. So we are not allowed to talk about your issues. When you enter my office as a social worker, you will tell me your problem or whatever you need. I'm not allowed to talk to my colleagues. I'm not allowed to talk to anybody else in that house unless you permit me to.
Yeah, that's very good. So that means there is completely confidentiality in whatsoever is discussed between you and them, and sure. Equally, even the medical practitioners are equally like that. Yeah, sure. I think this is very, very important. So, what are some of the recommendations that you will give to Gambians regarding mental health issues?
Good question. Next question.
What will you recommend them to do? Add sort of advice. This is last but not the least, my question to you. What are some of the recommendations you will ask them to do? Or take care of, because these are some of them, not everyone is like probably your husband or whosoever, who will be going and looking after himself. Some people might come with all this stress, but yet still sit like nothing happened. What would you advise them to do after going all these struggles, after facing all these problems, being here with all these bureaucratic issues, and by talking to them, you definitely know some of them are suffering from some issues, by just talking with them, because they become so. What will be your advice to the community?
Find someone you trust. Mm-hmm. Tell about all you need, what could help you, and try to find a solution together. Don't just stay in your room, take drugs, drink alcohol or whatever. Just go out and find someone you trust to talk to.
So looking for always communicate it with at least, a second party whom you trust is very, very important.
I don't think it's possible to get through all this all alone, all by yourself. I don't think. You need a network. You need people who you trust, and you need people who you can talk to. That's very important.
this is my last the last question for you, because we are running out of time now. Then I will get back to Evans, to ask him also 1 or 2 questions. Then we will stop it there. At the beginning of the talk, you were talking about some of the signs of mental health issues. So can you probably repeat it again, or probably deeply tell us, what are some of these signs?
I think when you see someone who's very aggressive from the very beginning, so some people, they don't even listen, they just shout at you because maybe you tell them something they don't like to hear, because we're not only social workers, we are camp managers. And if you tell them something like, please help cleaning, or please clean your room, they get very aggressive. So from the beginning, this is not normal, something's wrong with that boy or with that woman. Of course, sometimes they are like nervous. They're always on the run. They cannot sit there and listen to you. They always need to walk around. They forget things. You tell them something, they don't have that. They cannot keep them in their mind. They just forget. They cannot cope with all the documents in Germany. That's too much for them to have, because we have lots of papers. We use lots of paper in Germany, lots of letters. Every day is letter. That's too much for them. They're stressed about. They're very stressed about that. Sometimes addictive behavior. Sometimes they take whatever. It may be alcohol.
Yeah.
Or sometimes, if you're lucky, it's just cigarettes. They smoke a lot, but sometimes it's drugs like Bucky and whatever.
I agree.
Yeah, and I think that's the main. And they feel like I think they feel just overwhelmed, and they feel overburdened. They cannot take it. They don't know, what can I do now? I'm here in that country, and maybe they feel like nobody wants to help them. They have to get through all this by themselves, and they don't know what to do. And I think when you're a social worker for that long time, you see that very quickly. You know, okay, something's wrong with that boy. That's not normal behavior.
Thank you. Well, thank you for this detailed explanation. And I am glad we have you here today with the help of IOM. We have you here today, and surely Gambians will take advantage of this discussion. And if I know anything or any questions, and I think I know your husband, so we are.
I think so too.
So I will definitely direct them to you. Yeah. So I'm very, very glad. Before, let me just get back to Evans. Evans in Gambia. Some, Gambia, like, of course, English is our official language. But then your colleagues in Germany will tell you this. Sometimes communication between Gambians and your office, I don't mean you personally, I mean IOM. Sometimes, generally IOM, sometimes there is a communication breakout, maybe due to lack of language issues, language barriers. If a Gambian migrant is in Germany and facing this mental issue issues, if they have to call your office in Gambia to find out, or if somebody want to call on behalf of them, but they cannot speak English, what is there for you to be able to help them? Of course, you explain that you work with somebody who do radio programs, but then explain to us in details, to Gambians in details, if somebody here, he or she cannot speak English and really need your support, your office support, what should that person do?
Okay, thank you, Yaya. Mohammed just stepped out now. I would have told him to speak to you in Wolof or Mandinka or Fula. So that is to tell you how versatile we are. So if any returnee reaches us and needs that kind of support, and of course, we would be able to, Mohammed is there to speak to them in whether Wolof or even Mandinka. So we also have other colleagues like Lamin and other colleagues who have also been available to support returnees. So in fact, majorly, most of the times, they even do the sessions in a local language. They prefer to bring it home rather than waiting for the returnee to struggle with English and any other thing. So when they do that in the local language, you find them getting good kind of information from the returnees. And I think that has been part of what has been impacting positively our treatment outcomes, because these returnees are able to speak very clearly what their needs are and then how they would prefer to be supported. And even in terms of the assessments, whenever we start assessments, they try to do that as the forms are in English, but they try to post these questions at them with using the local language, any of the local languages. So that has been super helpful in terms of how we speak to migrants, to migrant returnees. Thank you.
Thank you very much. One more question, then I will get back to Velila to do the closing remark. Yes, when we talk about Gambian migrants, they are in Germany, and IOM office is not only in Gambia. Of course, they have, like Velila and the team are here in Germany too. What is your connection? Like, how connected are you? How do you cooperate? You know, the office in Germany, the office in Gambia, how do you cooperate in order to help this Gambian who is in need?
Thank God for internet. The wall now is just, our many walls are now one. So it's just like a stone throw. So whatever we do here, it gets to Germany within a split seconds. Just as we are talking on this platform, many other persons are hearing in Germany, right? So this is how we communicate with our different counterparts, not just in Germany, but from different other parts of the world. So whenever there are instances or there are cases as such, they would reach us to inform us that, yes, we have so individual or so case, and we would need your assistance. Of course, from our side as a receiving mission, we will try to advise, not to ensure, though, advise that the due diligence is done from their side. And when I mean due diligence, I mean detailed assessment, detail everything, and everything has to be done from their side. So it's not for us. What is left for us is, okay, once you have done that, then we will take it over. It's more like a 4x4 meter race. Someone starts with a button, he gives it to the next, he gives to the other person, and then the last person completes the race. So this is how the whole thing is done. So long as there's anything, Welly or Amira or anyone, Germany can reach us. Libya can also reach us as well. Different other parts of the world, migrants and returnees can also, messages about them can also reach us. And like I said, whatever information is shared with us about them remains confidential. It's only for the caseworker. It's only for those group of persons that are working on that particular case. So majorly, that's how we do our stuff. My colleague Mohammed just walked in. Maybe if you can give him a minute to just say a word to you guys. Mohammed, please.
Yes, thank you very much. Thank you, Evans. I think I would even prefer that, so that our fellow brothers and sisters will understand that this is purely just to give support. Mohammed, assalamu alaikum.
Walaikum salam.
Inimbara.
Urala wiyadi.
Alhamdulillah. Yahya, of course, a colleague, you know, well, ngalong ipota kalam talembe diamo minkeka. Just in 1 minute, you know, yeah, from bading Gambenolia, you know, Allah officer belori munela, al communicate no, albumune offanola to Gambians meli alanko ebe in Germany, but then probably mental health issue concerns or issues also. You know, all officer will blow community just in 1 minute. Ngara popre.
Okay. I hope Madi Mutanola, but coming you move keda modi mala ko mutamala di tara insilola. itata kumambetia inata officio mako yesena wala in fact itara no silo kan yemuru dan andona demaro futatema don talbuka kafu nyalo ko murundiro melo ko kafu me force return buka kafu je ba nyatale ila futara janna demaro so futano me mala nyatale ila ka ko futata mola so ngam mundino la mola komi demaro puri haklo iten yalla sonno mo hadamani mo bala jato la kendi aflo balo la kende ani sonno mo fan la kende so sonno mo la kende ngam mundi mo la wala ni futara jang nga ñi jibe nga je ko sulata demaro la ke futandi ngasilo itandi le se demaro soto no dame wala ngari faro dare re ta lo tano to ye boro soto ni boro sang nyata le afangi la kodo sendi le boro samunna wala sa ngalo tano jo kuli e jara so se okeno fula nyaw sa mun keno fala wala nga fu ye psycho education comme nge karandi ye ñi pouramo faham e sonno mo sasa faham hakili tan ko ya faham ya ka fu me positive coping mechanism hakilo bi tenku na nyaade bi fande manu la nyaadi be sila mo ko nyaadi se mo karandi no flan ye fande manu wala kadum the aim of psychosocial stability the one of the major aims coming ifan de mano moment ifan tara carrière sa ko ñile benna ni manke tan ñila ñanda ka ñile ka ni wosoto rek bu ñama question yalla kado ni fongé fongul yela fongole ko fambodi ni fongole la ko tamandi fambul aka feñamale ka fuima so ngam keno wolon nga psycho education ke ren ke rifa ke counseling psychosocial counseling falanke ani falanke psychological first aid ke upon arrival comme ni fotra airport or ni lumbe ne fotra airport ke information di la so na munna ni so telephone wala call ke ni la mole dia moy hakle tengu maybe so ta den ko la maybe so ta domoro la o in fact imon la so de la da ke ma ko la so de la da o be mo fem yalla ka harba harba di wala so mo tengu par harba di woni akuli andi ni akuli andi ka fajjala ka fanya mala ka fato sa kinno falam andi mo se sino parce ni silo be nyame be yalla no ni silo mo mi de come back to hopelessness, come back to disappointments. Family falling hopeless city be batuka. So it is implication of the family. Utron mu fende mialanko akatina dul la sonna mole boy koto. So if we so most of mialanko apa hin la family ko aldingo tada nata de bari mkaje nyele keta bari falan hanisa aldingo landa because harama ngo go fight aldingo de ko yara wole so ka ni family ke nga family mediation so nga family negotiation ko bo kaytane go aldingo nata hanisa aso tala de barola haje ki yara bara seke bo fala nyaro bot ngara ibonanta family kana bay be fala ko doje fala mu yalanko ni na re bo so ko futa so kono imo bo so ko futa so kono ni ngi ngam la de mo futa so kono ka ko malole beje war na te futa no so kono ni molte sino la do yale beje war ni molte so be mulde mu yalanko imo so boro la fam passé but isulota kachala mu yalanko be atne la ni molbe sino la watne be futa no so kono so time mo sia ba kale mbe kacha bi mata mu na important rek mental health amange fentu mu yalanko so no sasa amange fentu mu yalanko mu nyala kamalala. It's not something to be ashamed of. It's not something to be ashamed. Hardly in the Gambia here, you see someone, I tell I'm complaining that but this is something that we need to normalize in the society. It's very normal to go to the hospital and tell the doctor that you're having problem with your drink. These are things that it's normal to seek help for, because in the Gambia, most of the time, and even in Gambia living in Europe, sometimes they feel too strong to open up to people, we need to normalize this idea of speaking to people that you trust. We need to, because everyone has his own garbage. Momo ye fena so de la pozo meo me fo ni ma boni la pozo kono inani ini moli a share abe kuliala la alu pena be boni la ta jamfala ba. So if you are living in the Gambia, you are living in Europe, you need to have try to develop the passion of sharing with people. Ini mole si kacha because yang mo ikaflo ko mo multi ko to our button that more button we don't need counseling, we are not Europeans, but we are forgotten that we nga silota melo ko ni fana silota fala ka kidole to our button so dal fala sa be kide kan itebe Gambia di molbe siri ni mola konton ide mola ka sima ini molbe lew la bari fanje to awdu ma ko damalo imam moje imam baje imam faje damalo imam kotoje so on fulte mo dron mo stress only that is a source of stress. So but ni after any more kacha, I'm just alerted that the time is over. Unfortunately, I have to end it here. But mental health is something that we need to continue talking about. We need to continue reminding people that it's normal to have a mental illness, just like any other illness. Diabetes, hypertension, even suicide. Diabetes, for life. So no masasa habu kajara is a borotano for life, just like any other sasa. So among the son of Masaha for Moyan Bimu Boro Difa. So that's it. I hope we can get this conversation again.
Thank you. Thank you very much, Mohammed. Thank you. I'm glad that you give it the closing remark. So thank you very, very much. Evans, Mohammed gave a very, very good, short, detailed, explanation in Mandinka. It's very interesting, and I'm happy you gave us this chance also for our local listeners to be able to hear Mohammed summarize in a very good and perfect way. I'm happy. Thank you.
Many thanks to him. He's a great guy. Many thanks to him.
Yeah. Thank you very much. So we will just go back to Velila to give a closing remark, and then that's where we will stop. Before Velila start, let me just put one or two words. I think these are very important talk shows that Gambians we need. I always put this to my fellow Gambian brothers and sisters, especially those who in diaspora, not only even in Germany, in Italy, in other European countries, or other EU countries. IOM office is always there, open for you all, in many ways, in different issues. Just knock their door, voluntarily go there, knock their door for many things. It is not only about mental health issue. It is not only about you need a help to go home voluntarily. There are many things that they can support you. But if you just sit, and put your hands together, you sit down, you don't go and reach to them, you might not know what they are offering for you. And since for more than 2 years now, I start this connectivity networking with IOM office in Berlin, and I learned a lot. And I as a Gambian, as a migrant, I definitely know there are a lot of package there for us. You just need to go and grab it. So Velila, thank you. Welcome. I'll give you a closing remark.
Thank you, Yaya. And just to, basically connect to what you said, we are learning a lot from you as well, from the Gambian community and from you on how to engage, what to consider, and what's also important. So thank you for facilitating this amazing exchange. And I learned so much about this topic, and I'm so happy that we had Yvonne here. Thank you so much. Perhaps you also want to turn on your camera one more time for your amazing presentation and also for the answers to your questions. So that was also super helpful, and I hope that we can share all the information, also the contact details for all the services after on your Facebook. And thanks so much to Evans, who joined all the way from the Gambia to the session. I'm happy that we didn't have many technical problems, and I'm just grateful that we could talk about this topic in such an open way, to address it critically and also to address it from different sides and more from the approach or from the viewpoint of the migrant and the Gambian community here in Germany. So thanks so much for this exchange, and I hope we get to do another one soon, a follow-up. And I wish you all a great day, and hope that in Berlin it's raining. So I hope you have better weather in Baden-Württemberg and in the Gambia. Yvonne is shaking her head. So and I hope that everyone and all the viewers got to get some very good advice and support. And again, we will share all the contact information, the resources afterwards. Thank you. Thanks to you.
Thank you, Velila. Thank you, Madam Jata, Evans, Ben, everyone. We also have a technical team there. So I'm grateful. We will stop the Facebook Live today. And this is very, very interesting. And I hope we will be able to connect again and continue sharing information and help our fellow brothers and sisters. Evans, my next journey in Gambia, I will be in your office. I was there in January, but then I met few people at your office. Probably next time I will meet you too. That's how everyone. Inshallah. Bye-bye, everyone. Till next time again.
Bye-bye to you all. Thank you.
My dear brothers and sisters, I am very, very happy being IOM last staff so mental health issue so kacha because ni mukule de mi yalonko These are real things many are happen na community in Germany and other European countries even. You know, Gambia dingol me yalan ko ibe sofakang sasala. You know, sonde me kurang, one can say it in Mandinka. You know, siya batale. Na Gambia dingol me yalan ko ibe sofakang yin sonde me kurang wala sonde me kurang be attackang. Dolu ni tata silolu kang ni tata bano folto in Gambia dingol kama. And at some point, you know, wala kan ke isu soli me yalan ko mul kana ko Gambia no ka problemo ke Germany. A tara kule be akoma. Wolu man ke multi me yalan ko isu no mo be fangala. So what you say demaro soto no nyadi. You say demaro nyadi has a community, has Gambians, has, you know, institutions. These are dalilori why we bring these people here to talk. As a Gambian activist, I found it very, very difficult, disheartening. You know, Kagambe Dingoje in the street in Germany, you know, naked, you know, Kagambe Dingoje being brutalized by security officers in Germany. Just because he or she got mental issue. You know, because ala sense tabala, you know, acting abnormal, kamolu attack. So all these things, you know, is giving us a bad image as Gambians. So it is high time we as Gambians accept that this is happening. And we find out ways and means how to help our brothers and sisters who are in these issues. You know, so this is one of the reasons me and Nanganying program of Curate to bring these people on board. We talk about it, you know, we discuss about it and let our brothers and sisters know how to help themselves. If you are in such conditions, or you know somebody, or you are living with somebody, you know, usually people million of people suffering from these mental health issues. They are not living alone. They are living with us in our homes, in our houses, in our villages, cities. We know them. They are our brothers and sisters. So Nibeta can through such a difficult situation. You know, don't leave them alone. You know, try to help them. Don't leave it to be worse. Then you know, we can help them. We should not leave them alone. Our brotherhood should be far beyond that. To see a fellow Gambian living with him or her together, you know, having mental issues, and you just sit down like nothing happened. Let's help. And usually, many situation when they are sick, when they are getting sick, you know, usually they cannot report themselves. So you need to be there as a Gambian to help them. So dear brothers and sisters, this is the purpose of this program. You know, we bring them here so you can all share it with your fellow brothers and sisters so that all Gambians will be aware of this. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. We will end it here till next time. Ciao, ciao.